Hi, everyone. Thank you so much for coming to the symposium today. The hope in having me talk was to bring some actual experience of using this technology to you. And I hope that what I've picked out to talk about is useful for you to get a vision of what it's like to have the Ambition Imager active in your clinic. Let's see. There we go. Okay. Here's my conflicts of interest. I want to mention in particular that I have no financial relationship with Philips and that the honorarium for this talk is going directly to charity. I am here as a volunteer to try to help you understand better how these tools can help you in what you do day to day. So if you're treating patients these days in radiation oncology or in any branch of oncology, you're probably already using MR imaging. And depending on what treatment site you're most active in, you may use quite a bit of MR imaging. And so if that is the case, you already know that not all MR imaging is the same. You can get some very, very high quality, beautiful MR images that make it look like somebody actually sliced your patient in like a loaf of bread and they're showing you a slice. And then you can get some MR images that are not like that. I practice in a big tertiary referral center where a lot of times we'll get imaging from some other facility. And I have to tell you, I'm very spoiled. Our diagnostic imagers are also Philips based. And so I expect and demand very, very detailed imaging for my patients. And that's not always what I get from other facilities. If you're using MR imaging in order to do tumor delineation, in order to treat your patients, you know that fusion is always a problem. I brought you one of my favorite fusion examples here. This again came from an outside facility. This was a PET CT as it was sent to me. I hope I don't have to point out to you that the fusion was not exactly high quality here. And what that means is that the spatial resolution of the information that you're trying to get into your brain is not very good. And also that you're going to struggle to try to correct these problems in trying to actually use this imaging to treat your patients. And you don't need either of those things in your life. But even if the fusion is not quite this bad, you still have the issue of if you have a high quality MR and a high quality CT scan, the slices in those may not be always precisely parallel to each other. And that can leave you as the clinician struggling to try to decide how you want those images fused to each other. If you get the center part of the prostate perfectly fused, then maybe the superior edge isn't, or things of that nature. And again, it's a huge source of friction in what you do day to day that could be eliminated taking the right steps. And I'm hoping that I'm going to explain to you today one of the approaches you could take to getting that extra stress out of your life. The issue in particular for us is that time is cure. We have a big, busy facility. We have many MR imagers, but they operate just about around the clock, 7 days a week. And so before we installed our own MR imager in our simulation suite, we were routinely waiting 2 weeks to get an MR of the brain for a cancer patient. Now, that's very frustrating for you and me, but imagine what that's like for our patients when you talk about patient-centered care, telling them, I know you have a cancer, I want to treat it, I have to have MR images in order to treat it, but I need you to go home and wait for 2 weeks doing nothing about your cancer while we wait for the availability of the scanner. This is not the message we want to be giving to our cancer patients. It doesn't make them feel like they're in good hands, and it just truly is not patient-centered care. So what's a radiation oncologist to do? Well, here I have to confess that medicine is actually my second career. In order to pay for medical school, I spent 10 years in the United States Navy. Most of my operational time was spent driving this big, beautiful girl around the world. This is USS Enterprise. She can't quite beam you up, but is just about that amazing and very fun to drive. This is the Maserati of warships right here. And the reason is there are 8 nuclear reactors inside that ship. And that was my main job on the ship, was running portable nuclear reactors out there in the middle of the ocean. Well, even if you haven't experienced anything remotely like that, I bet you can imagine the fact that when something goes wrong in that big complex system, a part is broken, you don't have experts that you can call on the phone. Like when you work with Philips, you say, help us, and they come immediately and on the phone. It's not like that out there. You got to fix things yourself. You might even have to create a part for a machine yourself. So being out in that environment very much got me in the habit of fixing problems myself. And so when it came time to try to figure out what to do about these terrible delays and problems I was having with MR imaging, I really just wanted to do it myself. And thankfully, after a long wait, I was able to convince the leadership in my clinic that this would be a valuable, useful thing for us to have. And boy, has it exceeded their expectations for reasons that I'll explain to you as we go here. So this is us simulating a patient in our clinic with the beautiful system that you see here. And I just want to point out to you how compact that is, how modern looking it is. It just is a really nice machine. When our patients walk into this room, they go, yes, I am in a state-of-the-art facility. And it really helps them feel like they are getting the care that they deserve. Again, good patient-centered care. So this is my life now. If I'm in the clinic with a patient in a consultation and I decide that I need MR images in order to create the best treatment plan for them, I can add that on same day. I can make the decision to do an MRI, and an hour later, I have the images on my computer. Absolutely amazing, so much easier, so much friction has been removed from my life. And one of the additional things that this makes possible is that if there's specific needs that that individual patient has, let's say I want MR images, but I don't need contrast and I don't need 6 different sequences. I just need a non-contrast C2 and they can be on their way. I can tell my own people that, and they're in and out of that MR so quick in that case, and they can be on to another appointment or on the road home, whatever it is that they had that was pressing them for time. I can't do that if it's being run by radiology, right? It's 16 phone calls, and by the time I get all of the sequences chosen and so on, it's 4 hours later. Having fine control over this just has improved my life more than I can explain to you. And of course, then, although we have a routine where if somebody just needs standard brain imaging, I can send them off just like I always have for CT simulation. Now that I can control things, I can also hand select borders if I need a lower border that's, further down than we commonly use or anything like that. I have control over all of that and it still gets done quickly. But there's so much about having this capability that I did not anticipate. I thought about all these things I've said so far. I imagined it would be wonderful, and indeed it has exceeded my expectations. But there's so many things about this that I didn't expect that have made my day-to-day clinical life so much better. One of them is that for 2 body sites now, the pelvis and for CNS, I no longer do a CT sim at all. All I do is get MR images, and then a MR CT is digitally constructed for those patients. So I am delineating targets right on the MR images, and those are being taken right over to the CT scan that has been artificially created from those same MR images. So there's no fusion anymore. It's the same images. I no longer have to fuse anything for my pelvic cancer patients. It saves me so much time and brain sweat not having to worry about that one specific issue. And on top of that, as you can see, the images that I get are absolutely beautiful. Many times our simulation MR images rival what patients have gotten diagnostically and exceed them in a lot of cases. I had a long struggle convincing my clinic that we should have our own MR imager, but that wait meant that we got some really nice technology. We've got the very latest and greatest, and it has made a huge difference in my ability to see tumors. Another thing that we weren't sure we would get to, but just recently we just about a month and a half ago started treating patients on an MR Linac. And the seamless integration of our MR simulation with our Linac has been just absolutely beautiful. I was so worried about how much clinical time treating on an MR Linac would take away from me, it has been nothing at all. It is so easy to treat patients on that system. And part of what makes it so smooth and what keeps from stealing my clinical time to manage the situation is that our simulator, our MR simulator, integrates so perfectly with the Linac that there's not steps and waiting and concern about getting things across. They talk to each other perfectly. If I have a sequence on the simulator, I can get that same sequence on the Linac. So when we're doing day-to-day target delineation, I get exactly the images that I wanted every single day. It has worked really beautifully. Now, you know that it's always risky to try to run a video from a presentation. So we'll see if this works for us. There we go. Here's another thing that I didn't expect. Now, during my PhD in medical imaging, we were focusing a lot on stroke. And at that time, which wasn't that long ago, you couldn't get an MRI of a stroke patient's brain because they would be in the machine too long and it would delay their ability to get to clot busting drugs and save their lives. Now I'm standing there watching my patient breathing on an MRI, and you can see, even despite the motion, how clear that is. So here's another thing I didn't anticipate. I can analyze tumor motion on an MRI. It's mind-blowing to me. I feel like I live in Star Trek every single day. It's wonderful. Show that to you again. It just, can't believe it. All right, so here's what you need to do if you want to have all of these capabilities available to you too. Do you remember this from chemistry, the old energy of activation? You start with two reactants and you end up with some product, but the energy that you have to generate in order to get from step A to step B is actually a lot more than just the difference in energy between those two molecules. There's this threshold, this hump that you got to get over. That's what you need to do in your clinic. And the hump in your case probably consists, like it does in mine, of having to convince folks in the front office that this system is worth it. So my advice to you is to take the information that you're going to gather at the symposium here today, help them understand that the energy of activation, what they're investing up front and getting this system available to you, isn't the actual cost of the system, because they're going to regain so much in physician time that it will help pay for the cost of the system tremendously, because now I have all that extra time to treat more patients. And you know, those guys, that's what's first on their minds. They're going to be very happy when you tell them that. It's just really important to be able to paint this picture so that they can understand how that is true. And then finally, I want to mention that this is not your father's MR imager. You know, you also need to help your front office understand that, you know, they may have experience with installing MR imagers in the past, which was a very complicated process. You've got your Faraday cage and your quench pipe and all these things. Well, at least one of those steps has been eliminated now. No quench pipe necessary in our system. And that meant that installation was incredibly fast and smooth. Very short time from us saying, yes, our facility is available, to having an actual operating scanner there available to us. And then things progressed from there very smoothly into using it in our day-to-day work. So that is it for me. I hope that information has helped you, and we're going to hold questions until all of our speaking is done, but I'll stick around if anybody has anything they'd like to hear more about that.